I'm honored to open this listening session with you today and welcome the opportunity to reaffirm our government-to-government relationship on behalf of CDC and ATSDR. We strongly support and respect tribal sovereignty and self-determination for tribal governments in the United States and look forward to our ongoing collaboration to protect and improve public health. I would like to share a brief update on the state of the COVID-19 pandemic and provide a few agency updates related to our work with tribal nations. We have all watched this coronavirus evolve over the course of the pandemic, showing us that it is an opportunist able to quickly adapt to becoming even more infectious, and the Delta variant is still driving a surge in cases and hospitalizations. We continue to study and report on vaccine effectiveness and vaccine safety. Early in September, we published a study in the MMWR looking at COVID-19 cases, hospitalizations, and deaths in 13 jurisdictions. In this study, over 600,000 COVID-19 cases from April through mid-July were evaluated and linked to vaccination status. Looking at cases over the past 2 months, when the Delta variant was the predominant variant circulating in this country, those who were unvaccinated were about 5 times more likely to get COVID-19, over 10 times more likely to be hospitalized, and 11 times more likely to die from the disease. As we have shown in this study and many others, vaccination works. And so CDC will continue to do all we can to increase vaccination rates across the country by working with local communities and trusted messengers like you, and providing vaccine confidence consults to make sure that people have the information they need to make an informed decision about vaccination. On August 23rd, FDA provided full approval for the Pfizer-BioNTech COVID-19 vaccine for prevention of COVID-19 in individuals 16 years or older. While vaccine hesitancy has not disappeared, we have seen vaccination rates rise with this evidence of our faith in the safety and efficacy of the vaccine. Still, we are just shy of having 55% of the country fully vaccinated. While primary vaccination in the United States and around the world is our most important focus, FDA and CDC have recently taken steps to recommend booster vaccine doses as we work to stay ahead of the virus. CDC's updated interim guidance allows millions of Americans who are at highest risk for COVID-19 to receive a Pfizer-BioNTech COVID-19 booster shot to help increase their protection. At CDC, we are tasked with analyzing complex, often imperfect data to make concrete recommendations that optimize health. In a pandemic, even with uncertainty, we must take actions that we anticipate will do the greatest good. I believe we can best serve the nation's public health needs by providing booster doses for the elderly, those in long-term care facilities, people with underlying medical conditions, and for adults at high risk of disease from occupational and institutional exposures to COVID-19. This aligns with FDA's booster authorization and makes these groups eligible for a booster shot. Many Americans are also eager to know when vaccines will become available for children under 12, another important step in bringing the pandemic to an end. Because young children are still growing and developing, it is critical that robust clinical trials of adequate size are completed to evaluate both the safety and the immune response to a COVID-19 vaccine in this population. This could include whether there's a need for different doses or different strength formulations of vaccines already used in adolescents and adults. Clinical trials assessing COVID-19 vaccination in children are underway, and once they are finished, those data will be evaluated by FDA. Once FDA has authorized or approved a vaccine for children under 12, the Advisory Committee on Immunization Practices will meet to make a recommendation based on a thorough review of the available evidence. COVID-19 vaccines have undergone and will continue to undergo the most intensive safety monitoring in U.S. history. We are committed to providing the tools to help protect our children against COVID-19. CDC and our Advisory Committee on Immunization Practices will continue to follow the science, and evidence will inform our decision-making about vaccination for those younger children. It's also important to acknowledge how tribal nations have helped lead the way in getting people vaccinated. They vaccinated not only their members, but also community members and neighbors outside of their tribes. As of the end of August, over 2.1 million vaccinations have been administered through the Indian Health Service, Tribal Health, and urban Indian organizations enrolled through Indian Health Service or their state. Thank you for your efforts, which have provided much needed support to the country and to the entire public health system. CDC is committed to standing in partnership with tribal nations against COVID-19. We have expanded funding, provided remote technical assistance at the request of tribes, sent CDC experts and staff on field deployments, and provided support for COVID-19 vaccine implementation. The Tribal Support Section in CDC's Emergency Operations Center has deployed a total of 62 tribal support teams made up of 334 CDC staff to 30 tribal nations, 4 Indian Health Service areas, 1 tribal council, and the Bureau of Indian Education. CDC deployment teams provide hands-on technical assistance to tribal leaders and local public health staff on a variety of COVID-19 risk mitigation strategies, including vaccine hesitancy, testing and contact tracing, communication campaign development, use of surveillance data to inform decision-making, and K-12 school reopening. In fiscal year 20, CDC provided approximately $425 million directly to tribes and tribal organizations through cooperative agreements and grants. This is more than twice as much funding as provided in fiscal year 2019. Of that total, CDC directed over $200 million to supplement existing tribal programs to create a new non-competitive grant for tribes. CDC was able to reach 379 unique tribal recipients, almost 4 times as many as the previous year. And some recipients received funding through multiple cooperative agreements and grants. This funding was used to address the immediate needs of the COVID-19 response and to strengthen tribal health infrastructure and capacity. There are also many ongoing and upcoming CDC investments in tribal health across the agency at CDC. On July 23rd, CDC posted a forecast on grants.gov for the second round of funding for CDC's Tribal Practices for Wellness in Indian Country Cooperative Agreement. This funding supports tribal practices and cultural traditions to build resiliency and connections to community, family, and culture. Over time, these can be used to reduce risk factors for chronic diseases and promote health and wellness. Recipients of the new round of funding will include up to 18 federally recognized American Indian tribes, Alaska Native villages, or American Indian or Alaska Native tribally designated organizations serving a specific tribe, reservation, or native village, and up to 12 urban Indian organizations. In response to the disproportionate burden of maternal mortality among American Indian and Alaska Native populations, CDC's Division of Reproductive Health is supporting the National Indian Health Board in working to assist tribes and tribal organizations in exploring the possibility of designing and implementing tribally led maternal mortality review committees. In the coming year, NIHB will provide in-person and virtual trainings and will support Indian health boards and tribal nations directly via grants and technical assistance to conduct a readiness assessment. They will also build a resource library on maternal health and maternal mortality in Indian country. And on August 1st, our Division of Violence Prevention awarded $100,000 in additional funding to NIHB for a continuation of their project to develop culturally tailored materials and trainings on adverse childhood experiences. I'd like to close by touching on one of my top priorities as director, health equity. Back in April, when I declared racism a serious public health threat, my intention was to force us to reckon with long-standing racial and ethnic health disparities that are severe, far-reaching, and unacceptable. And at CDC, we are looking internally, embarking on an agency-wide strategic process that will make sure that health equity is central to the work we do, that every center, every division, every program is advancing these efforts. On July 31st, each part of the agency collectively submitted more than 150 health equity, science, and intervention goals that describe how we will continue to study the drivers and impacts of social determinants of health outcomes, expand the body of evidence on how inequities affect health, and propose and implement solutions. The submissions were impressive and testimony to our ability to weave health equity into every program at CDC and to implement transformative actions that will improve the health of all Americans. I look forward to sharing the plans with you at a future meeting. Through this work and working with you, our partners, CDC will holistically transform the way we approach public health within the agency, across the nation, and around the world. Again, I'm grateful for the opportunity to address you all today. I will now turn it over to Dr. Montero and others within CDC who will be on to hear from you all as we continue our work together to advance public health.